Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Kindly like, subscribe, and share. Expectorants are your go-to, a key ally in the fight against chest congestion. They're specifically designed for those times when you're battling chest congestion, that heavy, uncomfortable feeling that makes it hard to breathe easily. When a cough isn't clearing thick mucus, when it feels like you're just going in circles, expectorants step in to help by thinning and loosening it, making it less sticky and easier to move. This makes it easier to expel phlegm and relieve chest tightness, bringing much-needed relief to your respiratory system. The most common expectorant in the US is guaifenesin, a widely recognized and trusted ingredient, found in readily available products like Mucinex and Robitussin, making it easy to find relief at your local pharmacy. In Europe, bromhexine is also widely used. It's a popular choice for managing chesty coughs. It breaks down mucus structure directly, targeting the root of the problem for more effective relief. Expectorants are best for wet, productive coughs, the kind where you can feel the mucus present. They're particularly helpful for coughs stemming from colds, bronchitis, or flu, common respiratory ailments. They're not for dry coughs; those need suppressants instead. Using an expectorant on a dry cough won't be effective, and might even be counterproductive. Remember, expectorants treat symptoms, not the underlying illness, so it's important to address the cause of your cough as well. They're part of a broader plan: rest, hydration, and sometimes other meds, all working together to help you recover. Educate patients. Expectorants help clear mucus, making breathing easier and more comfortable, but recovery still takes time, so be patient and allow your body to heal. Patient understanding is key for safe, effective use, ensuring they get the most benefit from the medication. Expectorants work by making mucus easier to clear. Guaifenesin stimulates the stomach lining, triggering a reflex that increases watery secretions in the airways. This thins out thick mucus, making it easier to cough up. Think of it as turning sticky honey into pourable syrup. Bromhexine, a mucolytic, breaks down the fibers in mucus, reducing its stickiness. It also boosts surfactant production, helping keep airways open and aiding mucus transport. Both drugs make coughs more productive and airways clearer. Guaifenesin acts through a reflex. Bromhexine works directly on mucus. These mechanisms help relieve chest congestion and support the body's natural defenses. That's why they're effective for stubborn, wet coughs. Let's delve into the fascinating journey of how expectorants navigate through the body. We'll explore the processes they undergo from the moment they enter our system until they're effectively utilized and eventually eliminated. Guaifenesin, a common expectorant, is quickly absorbed into the bloodstream after oral intake, making it readily available to start its work. It typically reaches peak concentration in the blood within a relatively short time frame, usually between 15 to 30 minutes, indicating its rapid absorption rate. Once it has circulated and performed its function, guaifenesin is efficiently cleared from the body by the kidneys through the urinary system. Due to its short half-life, meaning it's quickly eliminated, guaifenesin is often formulated in extended-release forms. This ensures a more sustained and prolonged relief from symptoms. Guaifenesin primarily works by increasing the amount of watery secretions within the airways of the respiratory system. This increase in watery secretions helps to thin the mucus, making coughs more productive and effective in clearing the airways. Now let's shift our focus to bromhexine, another expectorant that is also readily and efficiently absorbed into the body. However, unlike guaifenesin, bromhexine undergoes significant conversion in the liver, transforming mostly into ambroxol, which is its active form responsible for its therapeutic effects. Ambroxol, the active metabolite, works directly to break down the structure of mucus. Furthermore, ambroxol stimulates the production and release of pulmonary surfactant, which further thins the respiratory secretions and significantly improves their clearance from the lungs. This makes bromhexine an interesting example of a prodrug, where its primary therapeutic benefits are derived from its active metabolite, ambroxol. In essence, both guaifenesin and bromhexine, through their respective mechanisms, ultimately contribute to helping the body clear mucus from the airways. However, it's important to recognize that their specific pathways within the body and their precise mechanisms of action are quite distinct. Therefore, a thorough understanding of these differences is absolutely crucial for healthcare professionals to ensure safe and effective prescribing practices. The ultimate goal of using these medications is to relieve chest congestion and to assist the body in its natural process of clearing away accumulated phlegm from the respiratory system. It's important to remember that expectorants are not a cure for the underlying illness itself. Instead, they primarily focus on alleviating the symptoms, making them easier to manage and improving overall patient comfort. And that is precisely where their therapeutic value lies within the broader spectrum of respiratory care. Expectorants are generally considered safe for most individuals when used as directed. However, like all medications, side effects can occur in some people. It's important to be aware of these potential effects. Guaifenesin, a common expectorant, may sometimes cause mild stomach upset, feelings of nausea, or a headache. But taking it with food or a full glass of water can often help to minimize these effects and make it easier on your system. In some cases, high doses can cause drowsiness or dizziness, so use caution when driving or operating machinery. Also, though it's rare, kidney stones have been reported in individuals taking guaifenesin, so it's crucial to stick closely to the recommended amounts and not exceed the prescribed dosage. Generally, drug interactions with expectorants are rare, but exercising caution when combining expectorants with alcohol or sedative medications is always wise, primarily due to the potential for increased drowsiness or sedation. Similarly, bromhexine, another type of expectorant, can sometimes cause mild stomach upset in sensitive individuals. In very rare cases, severe skin reactions have been reported with bromhexine, and these types of reactions require immediate medical attention and discontinuation of the medication. On a positive note, bromhexine may increase antibiotic penetration into mucus, which can be particularly helpful in treating certain respiratory infections where mucus clearance is important. To ensure patient safety, always review a patient's full medication list to check for potential interactions or contraindications. It's important to remind patients that taking more medication than recommended doesn't necessarily mean faster relief from their symptoms. It just increases the risk of experiencing unwanted side effects or complications. Therefore, safe use and a thorough awareness of potential side effects are absolutely essential for optimal outcomes. Special populations like pregnant patients need extra caution. Guaifenesin and bromhexine lack robust safety data in pregnancy, especially in the first trimester. Avoid unless necessary. Non-drug measures, hydration, humidifiers, rest are first line for pregnant individuals. Hydration is key for everyone. Expectorants work best when you drink plenty of water. Advise patients to see a doctor if cough lasts over a week, returns, or comes with fever or rash. Expectorants relieve symptoms but don't cure the illness. As future physicians, know their mechanisms, uses, and safety profiles. Emphasize correct use and patient education. Combine pharmacology with clear communication for best outcomes. That's how you help patients breathe easier and recover comfortably.